Yeah, first of all, essential tremor is one of the most common conditions that we see in a movement disorder subspecialty clinic. Unfortunately, up to half of patients don't respond to oral medications, and even those that do, their dose can often be limited by side effects. So there's also, in addition to a great need for better treatments, there's also very limited utilization of allied health professionals, particularly occupational therapists. And so we're in a situation right now where we're very limited in the number of treatment options available for mild to moderate essential tremor, but we do have advancing and expanding opportunities with some of the new approaches to more moderate to severe essential tremor with the advent of this MRI-guided ultrasound therapy and these newer and improved deep brain stimulation devices. Well, there are new practice guidelines that I think will be helpful for our colleagues in general practice. The Movement Disorder Society has recently published guidelines, two separate guidelines, one on evaluation, classification of tremor in general, and then a separate guideline consensus statement on therapies, both medication and surgical therapies and other procedures like botulinum toxin injection. So I think there's room for improvement in the utilization of the consensus guidelines for diagnosis and management. And up to now, there had been limited availability of the MRI-guided ultrasound thalamotomy procedure, but that is becoming more widely available. Yeah, I mean, I'm heavily biased because I'm also a clinical trials investigator, but the reason I am is I recognize there are very limited treatment options in the population I serve. So there are two main classes of medication that are currently in clinical trials. One is for what are called the T-type calcium channel inhibitors. There are two agents that are in development. The agent from Praxis showed promise in phase 2 and is now moving into the larger pivotal phase 3 trial. The other agent is from Jazz. The other type of agent in development is a positive allosteric modulator of the GABA-A receptor. This is a medication that has some tolerability issues, but in the patients that do tolerate, there does appear to be promise of benefit. So that is now in phase 2, and that's with Sage Therapeutics. So these are both categories of medication that we're keeping our eye closely on, and we're also directly involved in the trials. I like to say, even though the medications available haven't really changed yet, there has been a bit of a revolution in a couple of ways. First of all, these are conditions that are often under-recognized, and the Movement Disorder Society has recently revised their classification criteria for PSP, progressive supranuclear palsy, as well as for MSA, multiple system atrophy. And shortly before that, the consensus criteria for dementia with Lewy bodies were revised in 2017. So these criteria are going to be much more sensitive to detect patients who are likely to have an atypical disorder and to guide clinicians in their diagnosis. So that's one important change. I'd say the other really important change is this renaissance in biomarkers. It used to be that we could say we can only kind of be more confident in the diagnosis as the disease process evolves and once the patient has had symptoms long enough. We've just had some breakthroughs with synuclein biomarkers where even though we don't have good imaging biomarkers for atypical Parkinsonian disorders, we now have CSF as well as skin biomarkers that are going to be used in the research setting to differentiate synucleinopathy from other conditions. And some of these are already starting to be used in clinical practice, in particular the phosphorylated alpha-synuclein. It's known as under the name SYN1 by CND Life Sciences.